Few days back, a 59-year-old male came to my clinic. He's a known case of type 2 diabetes since last 8 years but on irregular treatment for the diabetes. Now, he is complaining of left foot swelling and ulcers since last 5 months. So, during this period, in the last 5 months, whenever he is having swelling, he would purchase a self-prescribed course of antibiotics from the local pharmacy and the swelling subsides. But this time, swelling is not responding to the self-prescribed course of antibiotics. So he came to me for examination. I did the local examination. I found a wound on the left first interspace. So the wound is showing a deep ulcer with an abscess. There is edema along with dark black mummified tissues surrounding the wound. So I done the local debridement and started on IV antibiotics, but the wound is progressing. It is not responding. Diagnosis? What is the diagnosis? So yes, it is a typical case of diabetic foot gangrene. As the foot is already dark, it is mummified. So the gangrene already started in the diabetic foot. So I'm going to teach you gangrene. Let's start gangrene. What is gangrene? Here you can see gangrene. In this video, I am going to teach you definition of the gangrene, the types of the gangrene. There are 3 types of gangrene. In each type, the definition of each, gross of each, and microscopy of each. So what is gangrene? What is gangrene? In gangrene, the necrotic tissue undergoes putrefaction. That is gangrene. Necrotic is the dead tissue. In dead tissue, bacteria are attracted. After coming in the dead tissue, the bacteria putrefy the tissue. So the dead putrefied tissue is known as gangrene. I can say gangrene is equal to necrosis plus putrefaction. So whenever only necrosis, I say only necrosis, I mean the dead tissue. But along with necrosis, if I am saying putrefaction due to bacteria, it is known as gangrene. So gangrene is equal to necrosis plus putrefaction. That is the definition of gangrene. What are the types of gangrene? There are 3 types of gangrene: dry gangrene, wet gangrene, and a special variant of wet gangrene which is known as gas gangrene. Dry, wet, and gas. So let me start. These are the 3 types of gangrenes. What is the difference between dry and wet? The 2 main variants. Gas gangrene is a variant of wet gangrene only. What is the difference between dry and wet gangrene? In dry gangrene, small amount, a few bacteria or no bacteria, or you can say very small amount of bacteria is coming. That's why putrefaction is very less and the tissue appears dry. The dead tissue appears dry. But in wet gangrene, the superinfection, the bacteria are abundant. The bacterial superinfection is abundant. That's why putrefaction is abundant and the tissue is looking liquefied because of the enzymes, and it is known as wet gangrene. So that is the basic difference between the 2 types of gangrene and their nomenclature, dry and wet. Special form of wet gas I will teach you. Let me first finish dry and wet gangrene. Let me start with the dry gangrene. What is dry gangrene? In dry gangrene, it starts usually in the distal part of a limb. So either it starts in the toes or it starts in the feet. It is due to ischemia, that is blockage of artery to that organ. Imagine the foot or the limb or the fingers, the toes, the artery supplying to that got obstructed due to any reason, due to trauma, due to spasms, due to atherosclerosis, due to any other reason, the arteries are obstructed. So that organ is not receiving the blood. Any organ do not receive the blood, that is ischemia. Ischemia causes cell death by necrosis. There are 5 types of necrosis. In necrosis lecture, I taught you the 5 types of necrosis. What are the 5 types of necrosis? It is coagulative necrosis, caseous necrosis, liquefactive necrosis, fat necrosis, and fibrinoid necrosis. Ischemia of all organs except brain is an example of coagulative necrosis. So here coagulative necrosis will occur. So because the limb, either the toes or the fingers, they are not getting the blood, the artery is obstructed. So coagulative necrosis will occur due to the obstruction of the artery, and it develops slowly. It is not very fast in contrast to wet gangrene, which is very fast. And in the diagram, you can see a foot is there, which is showing a gangrene, a dry gangrene. You can make out a line of junction. Can you see this line I'm marking? This is the line. This is the line of demarcation. I can separate on this side there is viable tissue, on this side there is gangrenous, the dead tissue. So there is a line of demarcation, a clear cut line of demarcation between the dead gangrenous tissue and the viable tissue. I can make out this line in case of dry gangrene, right? So you can make out this line here. So that is about the dry gangrene. A clear line of separation is formed at this point between the viable tissue and then the dead gangrenous tissue. That is dry gangrene. In dry gangrene, it is only coagulative necrosis. There is no liquefactive and others type of necrosis. Only coagulative necrosis is there, and it is slow. It is slow. Here the dead tissue is not digested. It is not removed, but it remains there. It got mummified. That's why it is black in color. Let me show you the gross. So in this foot, you can see this is a foot of a patient showing dry gangrene. You can see the gangrenous portion. You can make out a line of demarcation here. So the gangrene is looking dry. It is looking shrunken. It is looking dark black in color, resembling the foot of a mummy. That is a mummified tissue. The black color is due to liberation of hemoglobin from the hemolyzed RBC, which is acted upon by hydrogen disulfide produced by the bacteria, resulting in the formation of black iron sulfide. So there are RBCs got ruptured, they got lysed. From the RBCs, hemoglobin came out. This hemoglobin is acted upon by the H2S produced by the bacteria, and this will convert into iron sulfide. The hemoglobin will convert into iron sulfide because of the reaction with H2S which is produced by bacteria. So that is the reason for the black color. You must know the reason for a black color. It is also an important Viva question. So this dry gangrene, the specimen is present in most of the medical colleges, and in Viva's examiner likes this question to ask. First they ask the identification. If you are able to identify it is a dry gangrene, they will ask you the reason for the black color. The reason is this. There is a clear line of separation. I have already shown you the clear line of separation between the viable tissue and the dead tissue. Here also in this diagram, you can make out the line of separation between the dead tissue and the viable tissue. So that was the gross. Coming on the histology. If you make a slide, you will get only coagulative necrosis. What is coagulative necrosis? The outlines, the architecture is preserved, but the cytoplasmic and nuclear details are lost. And there is inflammation. Because it is necrosis, inflammation is there. So we can see it is a slide showing coagulative necrosis in which the outlines are preserved, but the cytoplasmic and nuclear details are lost. So cells are known as tombstone appearance or ghost appearance. And inflammation is there. That is coagulative necrosis. Now, coming on wet gangrene. What is wet gangrene? In wet gangrene, there is coagulative necrosis, but it is superimposed by liquefactive necrosis also. Because here abundant bacteria are there which is causing putrefaction. So in wet gangrene, dry gangrene mostly occurs in limbs, that is in digits, fingers or toes. Wet gangrene usually occurs in moist tissue and organs like bowel, intestine, like lung, mouth, cervix, vulva, all the moist tissue. So the site, preference of the site is different, right? Dry gangrene was due to obstruction of only artery, but wet gangrene is due to obstruction of artery as well as vein. So wet gangrene is the obstruction, it is due to artery as well as venous obstruction. Dry gangrene was slow to develop, but wet gangrene is very rapid to develop. In dry gangrene, there was a clear-cut line of demarcation which separate the viable tissue from the dead necrosed tissue, dead gangrenous tissue. But in wet gangrene, there is no clear-cut line of demarcation. So you can see this diagram. It is a diagram of intestine. This intestine, can you see this intestine here? This intestine is showing black color here. It is the gangrenous intestine. It is dead intestine. It is gangrenous. Intestine is a moist organ. It is developed very rapidly. It is due to the obstruction of artery as well as vein, and it is very rapid to develop. And I cannot make a line that this is viable tissue and this is dead tissue. There is no line of separation. So that is about the wet gangrene. Wet gangrene usually occurs in bowel in case of strangulated hernia. The best example. The second example was my story, which I have told you a case scenario in the beginning, that is diabetic foot. So diabetic foot is an example of wet gangrene because in diabetes, blood contains abundant of glucose and glucose attract bacteria. So high glucose content favors the growth of bacteria. So there are abundant of bacteria causing wet gangrene. So that is wet gangrene ka examples. In the gross, you can see the organ is putrid, rotten and dark. It is swollen. That is intestine. In microscopy, in histology, You will find coagulative necrosis with super-aided liquefaction necrosis. So in this diagram, you can see the intestine, you can see the 4 layers of the intestine: mucosa, submucosa, musculatus propria and serosa. Can you appreciate this? This intestine is viable, but this one is the gangrenous or dead one. You can appreciate here the coagulative necrosis along with some liquefactive necrosis. So that is the histology. So what we have learned the 2 types of gangrenes till now: the dry gangrene and the wet gangrene. The 2 types of gangrenes we have learned, the dry one and the wet one. Dry gangrene usually occurs in limbs, but wet gangrene usually occurs in the bowel or the wet organs. That is the site. Mechanism: dry gangrene occurs due to artery obstruction. Wet gangrene occurs due to blockage of artery as well as vein. Macroscopy: dry gangrene, that is gross. Dry gangrene are dry, shrunken and black. Here the organ is moist. It is not dry. Here it is dry. Here it is moist or wet. And both of them are dark, rotten and black, right? Putrefaction is less here, bacteria are less here in case of dry gangrene. But both things, numerous bacteria and marked putrefaction is there in case of wet gangrene. Line of demarcation, the most important difference, line of demarcation. Line of demarcation is present in dry gangrene. You can make out this is viable tissue and this is dead tissue, and there is a clear line between them. In wet gangrene, there is no clear-cut line. Prognosis: dry gangrene usually have a better prognosis, but wet gangrene have a poor prognosis. So these are the differences you must know between dry and wet. Now, what you have learned: dry gangrene and wet gangrene. Dry gangrene is an example of only coagulative necrosis, whereas wet gangrene is coagulative necrosis along with superimposed liquefactive necrosis. So can I say dry gangrene and wet gangrene? Tell me the necrosis in each of them. In dry gangrene, only coagulative necrosis is there. But in wet gangrene, along with coagulative necrosis, there is superimposed liquefactive necrosis also. So please learn these 2 points. Coming on the third variant, the third type of gangrene, a variant of wet gangrene, which is known as gas gangrene. So gas gangrene is a special form of wet gangrene. So here also bacteria will come. But which bacteria? There are some bacteria in microbiology which forms gas. So basically these are gas forming bacteria. These are gas forming bacteria. Gas forming bacteria, usually Clostridium. Clostridium is there. So here the organ is, you can see the diagram. Can you see these gas filled cavities? Here the bacteria is a gas forming bacteria. It is Clostridium. The organ is swollen, edematous, painful, and the organ is crepitant. Crepitant means it is a cavity containing the gas. Imagine this person is a known case, it is an accidental case. It is a road traffic RTA case. Road traffic accidental case, admitted to the hospital. He was traveling on a motorcycle. He got a road traffic accident. He fell down on the surface and there was a soil on the surface. So soil is inserted in the wound. He is having wound over the thigh and soil got inserted. In the soil, the spores of the Clostridia are present. After entering inside the muscle of the thigh, the spores got a favorable environment and they just grow into the bacteria. They develop into bacteria. So the gas forming bacteria, Clostridium, are formed and they start forming gas. They ferment the sugar present in the blood and they form gas. So gas filled cavities are formed. The prognosis is very poor. In this image also you can find the gas filled cavity. That is gas gangrene. So that is what we have learned today. That is the summary. There are 3 types of gangrenes: dry gangrene, wet gangrene, and a special variant of wet gangrene which is known as gas gangrene. We have learned the differences between dry and wet. Dry gangrene usually occurs in limbs. Wet gangrene usually occurs in bowel. So site is different. Dry gangrene occurs due to artery occlusion. Wet gangrene occurs due to artery and vein, both occlusion. In dry gangrene, the organ is dry with black color. In wet gangrene, organ is moist with dark black color. So color is common. About bacteria and putrefaction, both are less or limited in dry gangrene. Both are abundant and numerous in case of wet gangrene. If you say about the line of demarcation between the viable tissue and the dead tissue, the line is present in dry gangrene, but the line is absent in wet gangrene. If you talk about the prognosis of dry gangrene is better as compared to wet gangrene. That you must know. The most important point, dry gangrene is an example of only coagulative necrosis. In wet gangrene, along with coagulative necrosis, there is superimposed liquefactive necrosis. Diabetic foot is an example of wet gangrene. It is a very important university exam question. Diabetic foot. Now, if you think it is a foot, it should occur in the limbs. Dry gangrene is more common. No, but I know it is a foot. But still, in the foot, it is the wet gangrene which is taking place in diabetic foot. Because in diabetes, abundant amount of glucose is present in the blood that favors bacterial growth. So bacteria are numerous. They cause abundant putrefaction that will lead to liquefactive necrosis here. Superimposed liquefactive necrosis. You can see the two diagrams. This diagram is dry gangrene, in which you can make out a clear line of separation between the viable and the dead tissue. And this is a diagram of wet gangrene, in which you can see an intestine, but clear line of demarcation is absent here. So that is the thing. A third variant is gas gangrene is there. In gas gangrene, the bacteria is a gas-forming bacteria. Usually it is Clostridium. So spores enters inside the muscle and develop into the bacteria, grows into the bacteria. Bacteria form gas. So gas-filled cavities along with the necrotic tissues are there, which are crepitant. So that's all about gangrene.